Dr. Chivers, could you tell us a little more about your practice?
Well, my wife and I have been in practice for 15 years now. We have continued to evolve our practice since we started, and we've started to incorporate taping and laser therapy to the adjusting and the manual myofascial work we do. We really try and focus on finding out what's causing the pain versus just dealing with the pain, so that once we've got you out of pain, the problem is not likely to continue to reoccur, and eliminating kind of one of the big fears of going to a chiropractor, which is once you start going, you can never stop going. Our goal is to correct the underlying problem and get you healthy and get you back to doing what it is you'd like to do, and not having you have constantly re-injure or constantly be under some kind of therapy for the same problem over and over again.
That's great. Could you elaborate a little more on when you mentioned the myofascial work for somebody that maybe is not familiar with that?
In between your skin and your muscles, there's a myofascial layer, and they've discovered that the scar tissue that builds up in there and binds everything together is a huge causer of the problems as you start to lose flexibility and motion as things tighten up. That the scar tissue in those layers needs to be broken up. You constantly see high-end athletes now on foam rollers, and that's great for preventing it when you're working out, but if the scar tissue is already built up, you often need somebody to actually get in there and help break it up for you before you go on to just using a foam roller or a tennis ball or a lacrosse ball yourself to keep those areas in motion.
That's interesting. So what sort of things do you do to break it up?
We typically get in there with our thumbs and elbows, and I'll use a foam roller on a patient myself. We do try and then control the inflammation so that it doesn't swell up and hurt. We'll try using ice and cold laser therapy to eliminate the swelling, and a fair bit of stretching once we've started to break things up to get the muscles to heal back in the proper form, rather than with the calcium deposits and knots in them, so that they can stretch to their full length that they are supposed to.
And would you say that you're normally very successful with your patients doing this?
Yeah, we're very successful doing it. Sometimes, usually by doing an exam and x-rays if necessary, or an MRI, before we even start that kind of work on a patient, we've really already decided whether it's somebody we think it's going to be successful with or not. If there are underlying issues that we do not think it's going to be successful on, and that you're a case for a surgical consult, we typically would then send somebody out to an orthopedist or to a neurologist. So once we've decided to work on somebody, we're typically very successful, especially if a patient is compliant and exercises and does the things that we instruct at home. It is very successful.